Hello, my name is Yuzo Zhang. My topic for today will be mitral valve prolapse. So mitral valve prolapse is kind of a common disease that you will see in a lot of cardiac patients. Let's first go through some anatomy of mitral valve. Mitral valve is a bicuspid valve located between left atrium and left ventricle of the heart. It is attached to the papillary muscle through this tendons, they called chordae tendineae. So how mitral valve normally works? So during systolic phase, the mitral valve will open so the blood will flow from left atrium into left ventricle, and then during that systolic phase, the valve will close and the blood will pumping through that's from left ventricle to aorta through the aortic valve right here, back to to the systemic circulation. During systolic phase, the valve will close to prevent any blood backflow from left ventricle into left atrium. What if there's any problems with this valve? That will be, in this case, mitral valve prolapse. So mitral valve prolapse, what it really means is the valve collapses because the tendon which supports the valve it becomes detached. So it no longer supports the valve. So the valve becomes really flail, which means it's floating around in the left atrium. So whenever you will have, during diastolic phase, you will have blood flowing from left atrium into left ventricle. So that wouldn't have much problem because the valve will open anyways. The problem comes in when during systolic phase, when the left ventricle pumps the blood from left ventricle through aortic valve into aorta and then to the systemic circulation. So this valve, because the leaflet become really flail, it doesn't close 100%. So you will see like there will be a opening right here created by the free flowing of the valve, and then as a result of that, some blood from left ventricle will seep into left atrium. So you can see now all the blood normally will go into aorta. A portion of that will be going back into left atrium. So you can cause blood kind of pooling in here, where it doesn't give enough supplies to systemic circulation. That can potentially cause a lot of problems there. So what really causes the prolapse? It can summarize into three major etiologies. So the first one will be trauma. So any physical trauma to the heart can potentially dislodge the tendons, which is called chordae tendineae, from the leaflet of the mitral valve. So as a result of that, the mitral valve, the leaflet of the mitral valve will become flail, floating around in the left atrium like we mentioned earlier. So during systolic phase, it will create that opening for blood to sip from left ventricle back into left atrium. Endocarditis, interior inflammation of the heart, which can, such as endocarditis, can cause a mitral valve prolapse. Myocardial infarction. So what MI does to the heart is it can cause massive cell death. It depends on the degree of the MI. So imagine if the cell die of the valve, then the valve will no longer work. So it will definitely create that two-way opening, because if the valve doesn't shut, during systolic phase, blood will definitely flow from left ventricle back into left atrium. It kind of doesn't make much of a difference from just the tendon dislodge from the leaflet. It kind of having the same concept. So, what signs or symptoms do patients normally present with? So, most patients will be asymptomatic. That means they don't feel much difference. But, occasionally there are some people they are present with. I feel some chest pain, chest discomfort, chest tightness, and they can feel some palpitations. That can lead to some anxiety and even migraines. So I forgot to mention in here, there can also be some problems with, like I mentioned earlier, blood pooling in the left atrium. So that can potentially having a lot of embolism related problems. So how to diagnose a mitral valve prolapse? So cardiac exams by health professionals mainly used through listening to the heart, and the heart sound kind of gives this click with late systolic murmur. It will be click, click type of sound. So that's one of the way you can guess that this patient may present with mitral valve prolapse. So really the gold standard to diagnose mitral valve prolapse will be through echocardiogram. Through the echocardiogram, you can see how blood flows and how the leaflets of the valve works. I guess where the location are during systolic and diastolic and blood flow. So treatments. So the main treatments of mitral valve prolapse will be replacing the valve. Here you can either use mechanical valve or you can use valve from cadavers. Beta blockers are mainly used to decrease the palpitation, dizziness, and anxiety. patient can also sometimes use some painkillers for migraines and stuff like that. So here are the references. That is it about mitral valve prolapse. Should you have any questions, feel free to contact me through email. My email will be yzhang427@usuniversity.edu. That is yzhang427@usuniversity.edu. Thank you for listening.